If you're looking for ways to improve and reduce the swelling and lymphedema in your face and your neck area, keep watching this video. I'm Dr. Alex Hill. I'm a board-certified oncology physical therapist and a certified lymphedema therapist. In this video, I'm going to guide you through a gentle and effective exercise routine that targets the swelling in your face and your neck. Make sure to subscribe to my channel for more videos on lymphedema management. The lymphatic system relies on you moving and pumping your muscles to get that lymphatic fluid moving better. As muscles stretch and contract and pump, this helps to increase the lymphatic flow and move that lymph fluid out of that affected area, in this case, the head and the neck area. This exercise routine that I'm showing you in this video should be done at least once or twice a day. But if you're in the intensive phase of lymphedema treatment, where you're trying to actively reduce the swelling and get the face and neck smaller, doing these exercises more often can be helpful. If you have pain, shortness of breath, dizziness, or something just doesn't feel right, stop doing these exercises. You also want to check with your medical provider first before starting any new exercise routine. If you've had radiation therapy or surgery and you have tightness in certain areas of your neck or face, gently work your way to progressively larger ranges of motion with these exercises, and keep watching to the end of this video for stretches and lymphatic massage to help you get that range of motion back and improve your swelling even more. All of the movements that we do should be slow and controlled. You don't want to rush these or do these very fast. We're doing these slowly to help stimulate the lymphatic system, and we don't want to go too quickly. I'm going to show you each exercise several times, but when you perform these exercises throughout the day, try to do a set of 10 repetitions with each exercise. All right, let's get moving. The first exercise that we're going to do is deep diaphragmatic breathing. This stimulates the thoracic duct, which is the largest lymph vessel in the body and moves about 75% of the lymph in your body. Sitting back in a chair in a comfortable position or lying down, you're going to have your hands over your belly button. With this breathing, you're breathing in through the nose, you're filling up the chest, your ribs, and your abdomen, and you're breathing out through the mouth. Okay, so nice slow breaths. Hand on your abdomen, you're going to breathe in through the nose and out through the mouth. As you breathe out, you're going to use your hands to press down into your abdomen. Breathe in, breathe out, and press down. Breathe in and press down. So you're pressing down as you're exhaling. This is really stimulating that lymphatic system. We'll do one more breath. Breathe in through the nose and breathe out through the mouth. Give that little pressure down and into the abdomen. The next exercise is shoulder rolls. We're going to be doing them forward and we're going to be doing them backwards. So again, we want slow movements. We want large movements as well. So you're bringing your shoulders down and back, up, all the way to your ears, and then forward. Down and back, up and forward. So we want slow, intentional movements as you do these exercises. So again, I'm just showing you a couple repetitions just so you understand the movement, but make sure you're doing at least 10 of these at a time when you do them on your own. After 10 of them going forwards, then you're going to do 10 back. So really, again, big intentional movements, bringing them forward, up, and back, almost like you're bringing your shoulder blades down into your back pockets. Nice, slow movements. You can do these movements with your breath to make sure that you're not doing them too quickly. After the shoulder rolls, then we're going to start working on the neck. So again, if you have tightness, it's okay to start in a smaller range and progressively work your way up to larger ranges. So now we're going to work on neck rotation. So you're going to keep your shoulders still. You're not moving your whole trunk with you. You're going to rotate to look over one shoulder and then come back to center and then go back to the other direction. You'll pause at each end point. So you're going to turn one direction, pause, come forward, and then go to the other side. You can do this with your breath, so breathing in or out as you move your neck, just whatever feels comfortable for you. And again, you're going to be doing 10 of these each direction when you do these at home. Next up, we have side bends. So again, we're not moving our shoulders. Our shoulders and our trunk stays in place. We're just moving the neck. So with side bends, you're going to bring your ear to your shoulder and then back up to the middle. And then you're gonna bring your other ear to your other shoulder and then back up. So again, you're pausing at the end, come up, and then go to the other side. Again, slow movements. You're doing 10 of these on each side. You can do these with your breath. We just want nice, slow movements. We want a full movement if you can. If you have some tightness, again, just slowly work into that range. Next, we have flexion and extension. So we're going to be looking all the way up and looking all the way down. If you get dizzy with any of these movements with the head turns or looking up and down, keep it in a small range or skip that exercise. So you're going to look all the way up and all the way down. I like to breathe in on the way up and then exhale on the way down. A lot of times with fibrosis or scar tissue at the front of the neck, you'll feel a lot of stretch looking up. That's okay, a stretch is good. Little discomfort's okay, you shouldn't have any pain. But again, 10 times in each direction as you look all the way up and then all the way down. We wanna get into that full range. Again, nice slow movements. Next up are chin tucks. So when you do this exercise, I want you to try to make a double chin. I know that's something a lot of us try to avoid, but you're trying to make a double chin. So I'm going to show you from the side first and also from the front so you can see both angles. So from the side, you're going to, if you want to have a finger in front of your face, you're going to bring your whole head forward towards your finger, and then you're going to bring it back like you smelled something stinky. So you're going to push your jaw and your face forward and bring it back. Push it forward and bring it back. You don't want to do this hunched over, then that could cause some neck pain and not have as much range of motion. So making sure as you do these exercises that you're sitting up tall. Again, you're coming forward and then coming back. We want that double chin, okay? Pushing forward, bring it back, forward and back. From the front, it would be like I'm coming towards you, towards the camera and away from you. Towards the camera and away. So we want that double chin with this exercise. This is getting some of those deeper lymph nodes in the neck. Next is jaw protrusion. So now we're getting more into jaw movements. So with the jaw protrusion, instead of moving the whole head forward and back, like with the chin tucks we just did, now we're just moving the jaw. So again, I'm gonna show it from the side so you can see what part of the face is moving, and then I'll show you from the front. So with this exercise, you're bringing just your jaw forward and then back. So you can do that 10 times each direction. And I'll show you again from the front. So you're bringing just the jaw forward and then back. All right, next you're moving the jaw from side to side. Again, if you have radiation or some scar tissue, you might not be able to move it as much to one side. That's okay, just keep working on that range. So you're keeping head still, you're keeping shoulders still, just moving the jaw. You're going to move it to the left, back to midline, and then to the right, back to midline. So you're going to the side first. So again, you see my whole head's not moving, my shoulders aren't moving, it's just my jaw. Again, you'll do 10 times in each direction. I'll show you one more time. All right, the last movement here at the face, we are going to be opening our mouth and our eyes as wide as we can, almost like we're super surprised about something, we're really excited about something, and then we're going to tightly close our eyes, tightly close and pucker our mouth. So we're opening and closing. Again, we think about that muscle pumping action. We're lengthening, we're contracting, lengthening, contracting. So I'll show you again a couple repetitions of this. Make sure you're doing at least 10 when you do this at home. So you're going to open up wide and then close. This could be a fun thing to do if you have kids around or pets at all, and you can have some fun making some faces at them. But again, we want big, wide movements. We want slow movements with these. Again, doing at least 10 at a time. All right, the last part of this program is doing that deep breathing that we started with. So you're gonna have your hands over your abdomen, over your belly button. Again, you're breathing in through the nose, filling up your entire trunk. You wanna fill your chest, fill your ribs, fill your belly, breathe in through the nose. Exhale through the mouth. As you breathe out, that's when you're pressing into the belly. So we'll breathe in and breathe out, press into the belly. Breathe in and press in. And one more time, breathe in. And as you breathe out, press into the belly. Excellent job. I know some of those movements can be a little awkward to do. We're not usually trying to make a double chin or moving our jaw like that, but keep working on it. The more you do it, the more that will help with reducing that swelling in your face and in the neck area. I hope you found this video helpful. Please like it if you found it helpful, share it with someone who might benefit from it, and subscribe to my channel for more videos on lymphedema management.